Over the next 12 months, 1 out of every 3 people will show some of the signs of a psychological disorder. For some, the problems may be severe: clinical depression, obsessive-compulsive disorder, a life-limiting phobia. For most others, the symptoms will be less severe but still distressing, like Linda Minkoff, an average woman going through a difficult time after a divorce.
My life right now is completely different from how I ever thought I'd be living. In some ways I love it, in some ways it's definitely a challenge. I'm a nanny. I love being a nanny. But I'm single, and I'd never anticipated being single, living here, having to support myself. I've never supported myself before, so I'm having to relearn how to take care of myself, basically, and be completely on my own. I've never been completely on my own before. Well, recently he got remarried, and this is a man that said that he shouldn't be married. So that's been difficult for me to deal with. I'm eating too much. When I kind of get down a little bit, I spend too much money on things I don't really need. I have had some difficulty sleeping. And basically, my energy level is just not where I want it to be. I feel tired and kind of down all the time.
Linda's problems are not uncommon. Virtually all of us will face major transitions at some time in our lives. And in coping with them, we may develop symptoms of a psychological disorder. But most of us will not seek professional help. As little as 100 years ago, that would have been understandable. People with disorders faced treatments that were often more unpleasant than even the worst symptoms. But today, people are likely to find relief through psychotherapy, medication, or a combination of the two. The types of psychotherapy vary, but they all share the assumption that psychological factors play a significant role in a person's emotional, behavioral, and interpersonal problems.
Psychotherapy is a helping relationship, typically with between an individual and a mental health professional, where they meet together and work together, talk, ask questions, explore avenues of the person's life, and the two work together collaboratively to hopefully reach some goals.
Well, we are entering the final lap of this semester, and we have 3 more modules left, and they are certainly packed full with a lot of material, and they're kind of the crescendo in some respects of psychology, the study of psychology, which we've been spending the last 13, 14 weeks doing. And it's a fitting capstone to certainly the area that we just finished up with psych disorders. The treatment of psych disorders is, like I said, very much of a culmination of all the things that we know about human behavior and human thought and how to change human behavior, and that's, like I said, very much of a fitting perspective to end with here. So we're going to move our way into module 52. You can always tell when I haven't written on this tablet in a while because my handwriting gets a little shaky at the beginning. But module 52, we're going to talk specifically about some of the psychological therapies, not theories, but therapies, and specifically just treating psychological disorders. And generally speaking, when we talk about the treatment of psych disorders, everything hinges in a lot of ways on the therapist's philosophy of a lot of things, actually, not just counseling or just therapy. It has a lot to do with human nature, with how do we change behavior, how do people grow. All of those things are very much a part of the backdrop of the person's philosophy. So if they're interested in history, they become more psychodynamic. If they're interested in just changing the behavior and not worrying about what's going on in the brain and setting reinforcers in place, we're going to talk behavioral therapies. For those that are more interested in looking at and talking about the cognition, the thought process that people have, the perspective they have, then we're going to look more at cognitive aspects of functioning. So what you see here, which you may or may not recognize, is Freud's famous couch. Ironically, most counselors' offices have a couch in it, but it isn't certainly designed this way. This particular one was designed to fit Freud's purposes, but most counselors' offices look a little bit like a living room that allows you to be comfortable when you're talking about the issues that you are. So let's define our terms as we've been doing throughout. First of all, psychotherapy. You will hear people talk of psychotherapy and counseling in the same breath. It depends on their perspective as to whether or not these two are equal or not. Some people would suggest that counseling itself is more of a adjustment-oriented, growth-oriented counseling, if you will, or relationship that's built on that. On the other hand, psychotherapy, in some people's minds, is personality-oriented, personality change, those sorts of things. And that really, it depends. If you hear somebody use psychotherapy, like I said, most of the time it is used in synonymous terms with counseling. And typically what it involves is a trained therapist or counselor who uses psychological techniques to assist someone seeking to overcome difficulties or issues or achieve personal growth. So the key components here is, which I mentioned earlier, is the therapist and the therapist's role. In a lot of ways, one way to look at this is that the therapist is the instrument of change. Again, that's not necessarily stated in your book, but you go in to see a surgeon and he says, I think you have appendicitis and we will need to remove your appendix. The instrument of change in this case is the scalpel. Obviously the wisdom and so forth of the surgeon is important, but the instrument of change is I put instrument of change, is the scalpel. That's the actual thing that does the changing. And in counseling, the therapist is the instrument. The method by which they operate is their philosophy of counseling or their psych techniques. In this definition I just gave you falls into methods of counseling, theories of personality, which we've spent a little time talking about as well. And then thirdly, the outcome. And the outcome is geared toward one of two things, either difficulties or issues and trying to resolve those, or, and I'll just write because I end up saying too much, difficulties or issues, or growth. And there are plenty of people that certainly do come into counseling that for kind of a tune-up in a sense, and that's what kind of the growth orientation would include. Now, that's psychotherapy, and again, this is a real quick overview, but the second element, if you will, is biomedical therapies. And these have, as we've gotten greater and greater understanding and knowledge about the intertwining of biology and psychology, these therapies have moved further and further into psychology and the orientation toward this being a significant part. Now, again, remember, biopsychosocial. And there's a lot of therapy essentially that embodies this, because it includes the biomedical therapies, and these are basically what falls underneath these is prescribed medications, which we will look at in the last module when we talk a little bit about biomedical therapies. And they're looking at meds or medical procedures. A good example would be ECT that will change or directly act on the person's physiology. So that's that. And then the last thing, just to mention to you, you will see in your book, is something called Eclectic, an Eclectic Approach. And the Eclectic Approach is kind of an interesting word, actually, because if you think about someone who's eclectic in their taste, let's say for art, then they may like Picasso, they may like Monet, they may like Rembrandt, they may like any number of people. They're not devoted to just one artist, if you will. The same thing is true in counseling. An eclectic approach is where therapists use techniques from a variety of forms of therapy that fit the person's problem. So the approach changes in this case, and they are competent to use this, but the approach changes to fit the client's problems. And that's what we oftentimes refer to as eclectic. Some people, depending on who you talk to, may see this as a lazy way of doing it. In other words, the person really isn't making a choice. It's a little bit like the glorification of the moderate in politics today. The eclectic approach is somebody who isn't willing to commit to one theory and use that theory and specialize in that theory. On the other hand, there's a lot of benefit to this, to have a therapist who is familiar with and has used behavior therapy, who's familiar with and has used cognitive therapy. Psychodynamic, which we'll talk about here in a minute, is up for grabs whether somebody will be that way. I would say that generally most of you probably, without knowing it, are psychodynamic in your orientation when you think about how people change. If someone were to come to you and present you with a problem, and we talk about this in the clinical counseling methods class, is that they present you with a problem, then whatever next set of questions you ask will generally betray your orientation or your personal philosophy. And that's a lot of, we have been far more influenced by Freud's orientation than most people know. And that's something just to keep in mind in terms of thinking about how you change and also about how other people change.